morning, good afternoon, good evening, everyone. It's my pleasure to introduce you to the second conference that we're organizing in the context of the international research collaboration grants that we have been lucky enough to work on through a competitive process coordinated and led by our Faculty of Business and Law, together with Dr. Brackler and Dr. Melia, CIs in this international collaboration between the University of Newcastle and the University of Bologna. Francesco Paolucci, I'm a professor of health economics here at the University of Newcastle, and it's with great pleasure that I introduce you to this conference, basically showcasing the work developed so far within the collaboration with the University of Bologna, in particular with Professor Connelly, who's also based at the University of Queensland, Professor Fiorentini, Dr. Yommi, Dr. Naomi Moy, and Dr. Enriquez, all based at the University of Bologna. Now, we worked for the past year and a half developing a few projects that really focused on trying to get a better understanding around the institutional setting and the performance of chronic disease and their management across different institutional settings and countries. Obviously, 2020 has constituted has been proven to be for all of us a very complex year, and as you probably have had the chance to read in the news, and for those more interested in the COVID-19 pandemic, clearly the most affected people in the population globally has been the elderly and individuals with one or more morbidities. Clearly, chronic disease and chronic disease management has been a challenge for many countries for several years, and an efficient and equitable management of good quality of chronic condition is pivotal for the performance of our healthcare systems, and also, and more importantly, it's critical to actually preserve the quality of life of chronically ill individuals, which is clearly, and it was even before the pandemic, an existing pandemic. You can think of cardiovascular diseases, COPDs, but also important to point out mental health issues, which is often not considered a chronic condition, but in most or in many cases it is, and it is clearly even more important now to be aware of that, given that in COVID times, and very likely in the aftermath of COVID, that mental health will certainly be something that we have to tackle and preserve as best as we can, and clearly the government and industry support in this direction has already been quite important, not only in Australia but also in Australia. Obviously, as part of this collaboration with Bologna, we have had a number of papers and contributors, including Naomi Moy as guest editor to the special issue, together with myself and Dr. Lee and Jonathan Tritter from Ashton, making the University of Bologna, University of Newcastle, and University of Ashton collaboration quite an interesting development. Certainly COVID and remote working has worked in favor of this, because really the topic of this collaboration, which has collaterals and spillover effect on chronic disease and chronic disease management programs, both in terms of access and efficiency, and also of quality, because many people have forgone important care and also screening and maintenance for some critical conditions which might worsen the outlook for the conditions and the degeneration of some of these diseases going forward. As part of the special issue entitled The COVID-19 Pandemic, the Global Health and Technology Responses in the Making, published by Elsevier, we have a number of contributions that are part of these collaborations. Very important, the conceptual framework developed by Naomi Moy, myself, Marcello Antonini, Matthias Kistelt, and Professor Fiorentini, that really tries and look at mapping the key policy and technologies interventions, creating a gradient that can inform better on the intensity of the measures introduced to combat the spread of the disease, but also to combat the economic consequences and the health and healthcare system consequences of the condition. Also, we had 3 papers that were quite strongly applied papers, all published, one focusing on Italy, which was the first Western country hit by the pandemic, also with a very applied approach on the situation and analysis on the first phase. Also a focus paper on Spain, and another one on Australia. For Spain, we have Josefa, Enriquez from Bologna, Shannon has led, together with Caterina, the efforts for the Australian paper, and Chiara and Marcello have led the efforts for the Italian papers involving authors from Newcastle and University of Bologna. I would then move on to the other projects that we developed in the context of gathering a better understanding of chronic disease management and chronic disease management programs. Initially, the focus was very much on the comparison of Italy and Australia, and while we started looking at the systematic review around the barriers to the implementation of different mental health care funding models or provision, chronic disease management models in mental care, in other chronic conditions as well, we started soon realizing that this is an immense area, and probably it was worth focusing on one particular chronic condition and maybe delve into one particular aspect. So Chiara and Heidi have worked hard to select this area, and in fact are focusing on a presentation in this conference that looks at mental health and the barriers to implement in particular effective and cost-effective technologies, in particular e-health and digital health technologies, to actually improve the access to these services, and also the outlook for the patients who do access them. Clearly, chronic disease management is a very vast area, and we had to select specific diseases to gather the nuances and the differences in the way the programs are organized, and to understand better how some of the disease management programs introduced may actually contribute to improving health outcomes. This has been an effort conducted mostly by the Bologna team led by Fiorentini, Moy and Ayman, which really focused on some aspects and some particular programs on CKDs, and try to understand whether different models of care, what kind of impact they have on health outcomes and for patients, and also in terms of incentives, how they actually have curbed or changed physicians' behavior. Finally, the last two projects that are part of this collaboration involve the study of an international survey which focuses on the elderly. The survey is called SHARE. It's out of the University of Venice, initially constructed, and now it has several ways on a number of countries. And we took the opportunity for a broad team, including Menzakis, Nader, and Mahmoudi, and of course myself, Naomi Moy, and others, to try and understand from an econometric perspective the influence of morbidities on the utilization also of informal care and the use of informal care, and also try to understand better the impact of morbidities on healthcare use on actually mortality, which is something that quite surprisingly has been analyzed in isolation while we try to provide a comparative framework. Finally, a project that has been recently submitted to the Journal of Health Economics, led by Marika Yommi, with the contribution of Dr. Berquist from Berkeley and Professor Fiorentini from Bologna and myself, that looks at the application and the contribution of machine learning techniques in defining risk adjustment payments for NHS countries using Italian data, in fact, from the region Emilia-Romagna, where Bologna is based. Without taking further an additional time, I would also like to introduce you to a live lecture. We are very happy to have our collaborators from Bologna presenting on their research. We will have a nice panel of discussants from researchers based here at the University of Newcastle, including Dr. Savage, our behavioral economist. I hope you enjoy this session as well, and please engage with the live session, and of course engage with us through our Value in Health Economics group website and email. VIP has been very important and instrumental for us to be able to expand these collaborations, so we welcome you very much to stay in touch and let us know if you would like to hear more from us as well. Enjoy.